And back to you in the studio.
Thanks a lot, Stan. Now we're going to talk about some of the fears that a lot of people have. This is coming out right now. There's a lot of commercials on television that are being funded by various groups. And I think one of the biggest ones is the fact that some people believe that reform will ration health care. And I want to talk to you, how do you feel about that when you hear people talking about that with this new reform bill, Matt? Want to start with you, Nicole?
Sure. Well, I think when people use the term rationing, it's really with the intention of drumming up some fear and some anxiety, because no one likes the idea of rationing. But frankly, we already ration in our system now. There are many Americans who cannot get the kinds of care that they need. And there are frankly a lot of people who get more care than they need. And so I think what the Obama administration is interested in doing is sort of perhaps in redistributing who's getting what and making sure that we sort of share the resources in a more fair way. And I really think that that's where they're going. Dr. Stone?
Well, I think, you hear this talk about rationing, and I agree with Nicole completely, that, they make it sound like we're not rationing now and we're going to ration. And actually the evidence suggests that we probably ration healthcare more in this country than most of our other peer countries because we don't see as many get as many doctor visits as a lot of other countries get and things like that. And people also seem to be drumming up a lot of fear about this, something that sounds like government medicine. And really, the reform proposals that are being discussed are all about the government playing a larger role in ensuring financing is done fairly and efficiently and in guaranteeing that people get coverage. But there's nothing really being discussed that's going to talk about the government, telling me as a physician what we need to do. And I worked last night in the emergency room until midnight, and I saw almost half the patients I saw last night have no health insurance. Mm-hmm. And the other half, almost all of them, were on Medicare. So they were seniors, 65 and above, and they had good insurance. But I mean, last night in the ER in Bloomington, there was hardly anybody else there. And so there were the people who have good insurance, Medicare, and then there were people without insurance. There was one woman who'd been off her blood pressure medicine for several years. There was one man who'd been off his diabetic pills for over a year. I mean, when we talk about changing things, and some people say, well, you should be afraid to make any changes, I'd say we're really afraid to stay the way we are because it's really a terrible situation we're in, and I see it all the time in the ER.
Talking about fears, Elizabeth, you get a lot of questions from people saying, if this is passed, if this reform bill is passed, will VIM, Volunteers in Medicine, or programs like VIM close? And what do you say to them?
Well, we honestly feel that it'll be a long while before people are completely covered in this country in one way or another. And volunteers in medicines are starting all over the nation. Communities are getting together and coming up with ways to cover their fellow members of their communities with clinics like Volunteers in Medicine. And we do feel that it'll be a long time that people will be slipping through the cracks and not eligible for one type of coverage or another. So. Mm-hmm.
When all is said and done, I mean, I want to get your last thoughts because we only have a couple of minutes. Do things have to change? I mean, are we at the point right now, we're beyond the point right now where things absolutely have to change? Nicole?
I think we're really at that point. I think there are a lot of people who are really being burdened by their healthcare costs. Employers are struggling to provide health insurance for their workers. This is a big deal, and our health is very important to us. This is not something that is really optional, although unfortunately some people do treat their medical care as optional due to finances. And I think we're at a point politically, socially, economically where we cannot afford to wait much longer to really enact some meaningful reforms and get more people on insurance, put some cost controls in place, and just improve quality and access to health care.
Dr. Stone, we have about a minute.
Okay. Well, our current system, could hardly even be called a system. It's really a non-system, and it is too expensive. It's too unfair. We have the opportunity of our lifetimes to try to move things in a better direction, and I really hope we can.
Okay, fantastic. We've all been a wonderful panel, and thank you so much for being here. We appreciate it. We're out of time tonight. Thanks so much for joining us for this edition of INFocus, and of course, our panel experts. Stan, thanks for your help tonight as well.
And thank you. It was very interesting.
Don't forget to post your question for next month at infocus@indiana.edu, or if you would like to participate in a blog, leave a comment, or see portions of this show, please visit our website, indianapublicmedia.org/infocus. Next month, we will be discussing how new forms of media and technology influence various aspects of the business realm, next time on INFocus. Thanks so much for joining us. Have a great evening.
Production support for INFocus is provided by Smithville, a locally owned business serving central and southern Indiana since 1922, with residential and business internet, voice, and security services. Smithville, local pride, global technology. Information at smithville.net. And by viewers like you. Thank you